Welcome to this webinar series produced by the Commission on Cancer, which reviews the optimal resources for cancer care 2020 standards. This webinar will review Chapter 7. Next slide. Remember that these standards became effective January 1, 2020. I would urge you to review all information in our manual, which addresses any changes to our accreditation process. Also, new terms are defined in the glossary, and there are many specific category specifications which should be reviewed. Next slide. I would also urge you to access the 2020 Standards and Resource page in our website for more information on the standards and any upcoming educational activities, and this is the address for that. Next slide. Chapter 7 is a very important standard chapter, which involves the quality improvement standards for our process. Next slide. Now, the rationale is that quality improvement initiatives should focus on problem resolution and outcome improvement at your facility, and should be assurances that patients are treated in a safe manner. Cancer programs should develop a culture of collaboration in order to analyze and implement strategies that are based on data to drive improvement in the quality of care, and continuous quality improvement must be reflected in the results of these efforts. Next slide. Standard 7.1 involves the accountability and quality improvement measures. The Commission on Cancer requires accredited cancer programs to treat cancer patients according to nationally accepted accountability and quality improvement measures indicated by the COC quality reporting tools. Now, the scope of this standard involves the monitoring of the Cancer Committee by what's called the Estimated Performance Rates, or EPRs, and these may be accountability measures or quality improvement measures that are selected annually by the Commission on Cancer. If an expected EPR is not met, then a corrective action plan must be developed and executed. Now, these corrective action plan must document how the issues for each process will be investigated and how the deficiency, if noted, will be resolved and the compliance improved. Next slide. The scope of the standard further involves the Cancer Committee responsibilities. The Cancer Committee should review the compliance with required accountability and quality improvement measures. They should monitor these activities and develop any action plan when needed to correct any EPR. It should document the activities carefully in the Cancer Committee minutes. Programs with no cases eligible for assessment in a selected measure are exempt from requirements from that individual measure. Next slide. Now, the PRQ must document these carefully, and the Cancer Committee minutes must be uploaded and show that each of these measures is presented and reviewed by the Cancer Committee, and that any required action plan has been offered. Next slide. Further, compliance indicates that the Cancer Committee should monitor the program's expected EPR for accountability and quality improvement selected by the COC, and that the monitoring activity is documented very carefully in the Cancer Committee minutes. For each of these improvement measures selected by the COC, a performance rate should be equal or greater to the expected EPR specified by the COC. If this is not met, the program has to implement an action plan for improving the process and hopefully meeting the expected EPR. Next slide. This should involve an in-depth analysis of the diagnostic evaluation and treatment of individual patients, which is reflected by Standard 7.2. Now, Standard 7.2 is performed by a physician and it confirms concordance with certain guidelines. The scope of the standard should show that study should be retrospective and it should be a review of individual patients' evaluation and treatments performed. It includes a patient medical record review. It should be a study that is shown that results are presented to the Cancer Committee and should be clearly documented in Cancer Committee minutes. Furthermore, this standard, 7.2, should show that an annual in-depth analysis must include all of the following components. It should include the patient population that's reviewed. It should include sources for the assessment of the study, which are either all cases from a specific cancer site, up to a maximum of 100 cases, or should identify a need by the institution to review this particular patient population or stage of cancer. Next slide. Furthermore, the scope of the standard should show that a thorough review of the pre-treatment evaluation by reviewing the medical record or a pre-treatment initial diagnosis evaluation is concordant with evidence-based national treatment guidelines. Now, this could be done by an initial evaluation by pathology reports, diagnostic imaging of a certain site, laboratory tests, or recommended consultations. This should include a thorough review of first course of treatment management by review of the medical record or a first course of treatment by the stage of disease or other prognostic indicators, and should be concordant with evidence-based national guidelines. Next slide. Furthermore, for Standard 7.2, the reporting format should permit an analysis and provide an opportunity to recommend performance improvements. The reporting should detail all of these required study elements, the results of the analysis, the presentation to the Cancer Committee, and the documentation in the Cancer Committee minutes, including any recommendations for improvement. Next slide. The evidence-based guidelines do have some exceptions. The analysis and treatment discussions for patients at multidisciplinary cancer case conference do not fulfill the requirements for this particular standard, which is an important thing to remember. Next slide. The PRQ has to show the documentation of this in-depth analysis for Standard 7.2, and it should be included very clearly in the Cancer Committee minutes. Next slide. Compliance is measured on the fact that a physician who is chosen by the Cancer Committee conducts an in-depth analysis to determine whether the initial diagnostic evaluation or treatment provided to patients is concordant with evidence-based national treatment guidelines. And the report detailing all required elements of the study, including the results of the analysis, and any recommendations for improvement are reported to the Cancer Committee and are carefully monitored by the Cancer Committee minutes. Next slide. Standard 7.3 is an extremely important standard that involves the quality improvement process at the institution. The annual cancer-specific quality improvement initiative is involved in this particular standard. Now, this should be guided by the cancer liaison physician, the cancer quality improvement coordinator, or the entire Cancer Committee, and certainly should have all three involved. The scope of this particular work should measure the improvement initiative, evaluate the initiative, and show how this has led to improvement of cancer care at the institution. Now, the quality improvement process must identify a problem, must understand what is causing the identified problem, and must implement a planned solution to the problem. reports given to the Cancer Committee at least twice each calendar year and documented in the Cancer Committee minutes must result from this QI process. Next slide. Now, the scope of the standard should be to review data first to identify a problem. This should focus on an already identified quality-related problem specific to the cancer program. Now, there could be various ways to identify problems at the institution and then to focus a QI initiative. These could be problems identified by the NCDB accountability or quality improvement measures. They could be problems identified by the standard 7.2 when a specific patient site or treatment is reviewed using evidence-based guidelines. It could be reviewed by problems identified through annual review of clinical services in other COC standards. For instance, when we identify and review our palliative care guidelines or genetic services or operative standards. It could be identified by problems identified through the National Accreditation Program for Rectal Cancer or National Accreditation for Program for Breast Centers, if those are available at your institution. It could be problems identified through review of NCDB data that are gathered other than accountability or quality improvement measures, including Cancer Quality Improvement Program or CQIP data that is given each year to the facility and reviewed by the CLP, or any other cancer-specific quality-related program determined by the Cancer Committee. Next slide. Now, further, the scope of the standard should involve writing the problem statement. The QI initiative must have a problem statement that is clearly defined, and this problem statement must identify that a specific, already identified quality-related problem specific to the cancer program is identified and must be solved through a QI initiative. It should identify the baseline and the goal metrics that are going to be used for measurement, and should anticipate a timeline for completing the QI initiative and achieving the expected outcome. The problem statement cannot state that a study is being done to see if a problem exists. Rather, it must already be known that a certain problem exists at the facility. Next slide. Furthermore, the scope of the standard must choose and implement a performance improvement methodology to use to evaluate the metrics. The Quality Improvement Coordinator, or the CLP, must identify the content experts needed to execute the Quality Improvement Initiative. They must choose a recognized, standardized performance improvement tool to conduct the QI initiative. The team must conduct an analysis to identify all the factors contributing to the problem and develop the interventions to fix the problem once these are identified. They have to develop the use of a project calendar. In other words, the launch date, the reporting of updates, and when this process will be wrapped up by the institution. And the quality initiatives should be at least given in a 1-year time frame. You could extend the time frame if needed, but this should be established by making a new initiative each year if there's an extension into the next calendar year. Next slide. Now, implement intervention and monitor data. The intervention chosen in step 3 must be implemented. If oversight of the implementation suggests the intervention is not working, then it certainly must be modified during the process. Next slide. Number 5, the quality improvement initiative summary or initiative summary must include that the initiative has been completed, that a document summarizing the initiative and results must be presented and discussed with the Cancer Committee, and that this must be included in the Cancer Committee minutes. and must result in a comparison with national data. Now, the summary could include a summary of the data identified to identify the problem statement, the QI initiative team members who were involved in the process, the performance improvement tool utilized, the intervention implemented, and if applicable, any adjustments made to the intervention. The results of the implemented intervention must also be stated. Next slide. Furthermore, the Quality Improvement Initiative must show that the CLP or the Quality Improvement Coordinator updates the Cancer Committee on the Quality Improvement Initiative's status at least twice each calendar year. This status must include the current status of the initiative and the planned next steps. Now, the final summary and results must qualify as one of the required reports. Next slide. The on-site documentation for Standard 7.3 will be reviewed by the site reviewer and will document the QI initiative's teamwork throughout the initiative. The PRQ, the documentation, should involve and should update the annual QI initiative summary, as well as the Cancer Committee minutes that are required in this particular review process. Next slide. Compliance is based on one quality improvement initiative that is identified by the institution as being a problem and is initiated each year. This initiative should include how it's measured, evaluated, and improved through implementation of a recognized standardized performance improvement tool. The status updates should be provided to the Cancer Committee at least twice annually, and these reports are clearly documented in the Cancer Committee minutes, and a final presentation and summary is made at the conclusion of a review of the QI initiative. And this summary presentation should include all required elements of the standard. Next slide. Standard 7.4 involves goal setting. And annual goal setting provides direction for the strategic planning of cancer program activities. The scope of the standard should involve that one cancer program goal is established each calendar year. And the Cancer Committee must not only establish the goal, but must be documenting how the goal is being met. And one of the ways to document carefully goal setting is to use what's called the SMART criteria. This is identifying a specific process or specific problem or specific goal, how it's measured, how do we achieve it, is it realistic, and is it timely? And direct goals to the scope, coordination, and practice and process and provision of services for cancer care should be identified by the Cancer Committee and should be used for goal setting. Next slide. Now, for the standard of cancer program goal setting, the Cancer Committee must document the status and update on the process of goal setting at least in 2 subsequent meetings after the meeting to identify the goal is established in the same calendar year. So goals should really be listed and be followed for 1 year only. New goal establishment at the beginning of each calendar year, even if a previous goal is still in process, will be required by the Cancer Committee. Next slide. Cancer program goal exceptions. Now, a goal cannot duplicate any requirement of a standard. To be an improvement or requirement from another standard does not suffice as being a goal, and to be a program or initiative submitted to meet requirement of another standard cannot act as a goal-setting process for the institution. Next slide. The pre-review questionnaire should document clearly the cancer program goal setting process. It should be shown in the Cancer Committee minutes that the documentation was established and that the goal was either met or not met during the process. Next slide. Compliance of Standard 7.4 is based on the fact that one cancer program goal is established annually by the Cancer Committee, and that at least 2 status updates during the year are given to the Cancer Committee to show the process on goal setting. For any goal extended into a second year, at least 1 status update must be documented in the minutes during the second year to indicate whether the goal was completed or retired. This completes our review of Standard Chapter 7.